There's good and bad in everything, and unfortunately, that's true in healthcare as well. Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today, we're going to talk about bad treatment, what it looks like, what to look for, and how to move past it. Stay tuned, we're talking about it right now. As a healthcare provider myself, I know that providers want to do what's right for their patients. They want to do what's best for their patients. But sometimes, just like in any profession, there's good and bad treatment, there's good and bad providers. Sometimes a provider is overworked, they're burnt out, they just feel something has gone on horrible in their lives, and they just start not doing good work. Other times, providers might get caught in the business part of things, and they might forget what it was like to give good health care. Sometimes they're just too darn busy. But no matter the reason, if it's your body or that of a friend, family, or loved one, you want to make sure that if you feel at any time that care is not in your best interest, that you take immediate steps. Now, what should you do if you feel that you're going to care, but that care is just not working, or at worst case scenario, that the provider or providers aren't even paying attention or caring? First thing, bring them awareness. And that means speak your mind. If something's going on with a provider, in my case, chiropractic or complementary and alternative medicine, if someone is feeling that they're not being listened to, heard, given time, or that the treatment is overly painful and the provider's not expressing why they feel that, or the provider keeps doing the same thing that's causing a negative result, that's something that you as a patient need to let them know about immediately. Now, if they continue to do that, or if their reasoning for that expression of healthcare isn't up to standard for you, take a time out and go see another provider of the same category and get a second opinion. You don't want to go too far doing things that aren't working or that are hurting you without you knowing why that you're doing that. Now, the next thing that you want to check out when a thing is potentially going bad is you want to talk to the other staff members in that office and give them your concerns. So you raise it to the provider. If that doesn't change it, raise it to the staff people in the office and let them know that you're going to go get a second opinion as well. This will set the stage that there's witnesses of people understanding that you need help in this case. So once you've done that, then do get a second opinion. Go for a different type of treatment for your condition or a different provider that does the same treatment so that you can know, are there other options? Because oftentimes there's a provider that's perfect for every single patient type, no matter what the condition is, no matter what the personality type is. If you match provider, treatment, and patient, you usually get a really favorable outcome given whatever the case may be. So if you have questions on this, please let me know. You can email me, jim@ramoslaw.com. And if you do have questions that you would like us to answer on the show, please let me know that too. You can send that in. But I hope that you find the providers that work for you. And if it's not working, don't stay, go find someone else. Of course, if you like this, please send it on, share it, and just know that in all of our lives, health matters.